Hello everyone and welcome to my channel Body Mind Healing. My name is Maria Sanchez. I am a holistic health consultant, a family nurse practitioner, a psychiatric mental health nurse practitioner, and a doctor in nursing practice. The case for today is Obsessive Compulsive Disorder, OCD, versus Obsessive Compulsive Personality Disorder, OCPD, clinical and spiritual perspectives. Let's understand OCD first. Obsessive compulsive disorder is a mental health condition defined by obsessions, meaning repetitive, intrusive, unwanted thoughts or urges, and compulsions, meaning behaviors or mental acts performed to relieve anxiety or prevent imagined harm. Patients with OCD might wash their hands repeatedly to feel safe from contamination or check doors and stoves over and over to avoid imagined danger. The cycle of obsession and compulsion consumes time, drains energy, and interferes with work, relationships, and daily living. Importantly, patients with OCD usually realize their behaviors are excessive or irrational, yet they feel powerless to resist them. This clash between awareness and behavior is called ego-dystonia, meaning the symptoms feel unwelcome and in conflict with the person's values. Let's now look at OCPD. Obsessive Compulsive Personality Disorder is not the same as OCD. This is a personality pattern marked by rigidity, perfectionism, and an excessive need for control. Instead of obsessions and compulsions, OCPD shows up as preoccupation with roles, order, and productivity. Key traits of OCPD might include excessive devotion to work at the expense of leisure or relationships, perfectionism that interferes with task completion, rigid moral or ethical standards, unwillingness to delegate unless others follow exact methods, difficulty discarding possessions even when worn out. Unlike OCD, patients with OCPD usually believe their behaviors are right and necessary. This is known as ego-syntonic, meaning their traits feel consistent with who they are, even when these traits cause friction in relationships or work. Now let's look at key differences between obsessive compulsive disorder and obsessive compulsive personality disorder. The nature of symptoms in OCD involves intrusive thoughts and rituals. In OCPD, involves personality-based rigidity and perfectionism. Insight. In patients with OCD, they usually know their behavior is unreasonable. Patients with OCPD often feel justified in their rigidity. Impact. In OCD, creates distress from the endless loop of obsessions and compulsions. In OCPD, causes a strain in relationships and life balance. Course. In OCD often begins suddenly in adolescence or early adulthood. In OCPD, the traits appear gradually and remain stable. The treatment in OCPD responds well to cognitive behavioral therapy, especially exposure and response prevention, and certain medications. In OCPD, is best approached with psychotherapy that softens rigid patterns and increases self-awareness. Now, it is possible to have both conditions, but they are not two versions of the same disorder. Obsessive compulsive personality disorder is not a milder form of obsessive compulsive disorder. Each one of these disorders requires different understanding and care. Now let's visit the spiritual meaning of obsessive compulsive disorder. From a spiritual lens, OCD reflects the soul's struggle with uncertainty. Rituals and compulsions become symbolic attempts to find purity, safety, or control in a world that feels unpredictable. Spiritually, OCD might represent a distorted form of devotion where rituals replace genuine surrender. A fear of imperfection masking a deeper longing for faith and trust. The ego's battle with chaos while the soul invites flow and presence. Soul lessons include releasing the illusion of control, learning to rest in uncertainty, and transforming compulsions into conscious practices of compassion. Affirmations such as "I am safe even in the unknown" or "peace lives within me, not in rituals" can be grounding. Practices like mindfulness, grounding with nature, creative expression, and daily moments of surrender support healing. Now let's see the spiritual meaning of Obsessive Compulsive Personality Disorder. OCPD reflects the soul's attachment to perfection and control as a way of earning love or safety. Spiritually, this might come from ancestral imprints around duty, survival, or morality. It often represents a karmic contract with order where the soul must learn to balance structure with freedom. Spiritually, OCPD might symbolize the overactivation of the inner critic, fear of letting go with perfectionism as protection, a defense against vulnerability and spontaneity. Soul lessons include embracing imperfection, cultivating play, and realizing that love is not conditional on flawless performance. Healing comes through creative freedom, compassion practices, and learning to soften rigid standards. Affirmations such as "I am worthy even when I am not perfect" or "Love flows when I release control" encourages this shift. But now, do these two disorders share spiritual themes? Though different, both OCD and OCPD highlight the universal human longing for safety and order. They mirror the tension between control and flow. Our inner guidance calls us to trust that true peace does not come from rigid rituals or flawless standards, but from surrender, presence, and love. In conclusion, Obsessive Compulsive Disorder represents the soul's desperate attempt to ward off uncertainty through ritual. Obsessive Compulsive Personality Disorder represents the ego's attempt to secure love through perfection. Both ask us to release fear, embrace imperfection, and trust the divine unfolding of life. By softening control, we open the heart to freedom, peace, and wholeness. Now, let's not forget that healing is not a destination, but a constant return to our own wholeness. Every step, even the smallest ones, matter. Until next time.